Good afternoon, dear colleagues. For me, it's a great pleasure to participate on this symposium and welcome you today. In my presentation, I would like to demonstrate my report on complex approach to the chronic migraine treatment, the connection between Western and Oriental medicine. Our research is dedicated to one of the most important and highly prevalent disorders, as well as one of the most common primary headaches seen in neurologic practice, migraine. Migraine, or also known common migraine, hemicrania simplex, is identified as a complex recurrent disorder manifesting in headache attacks lasting 4 to 72 hours. On diagnostic criteria of migraine, according to International Classification of Headache Disorder of International Headache Society, we can recognize that expected quantity of attacks to be at least 5 per month, lasting from 4 to 72 hours, untreated or unsuccessfully treated. It is appropriate to consider the diagnosis of migraine if it demonstrates at least 2 of the following 4 characteristics: unilateral location and pulsating quality. I would like to emphasize that one of the main attributes of migraine is the intensity of pain, which can vary from moderate to severe, aggravated by and causing avoidance of routine physical activity, walking or climbing stairs, not to mention that a patient suffering from headache can have at least one of the following: nausea and or vomiting, or photophobia and phonophobia, light and sound sensitivity. And also, hangover is another type of primary headache, and potentially everybody experiences this type of headache at least once in their life. Migraine is one of the most common disabling primary headache disorder, which significantly reduces the quality of life. Statistics say that there are about 40 million people affected in the United States, 72% of the population only in Moscow, and up to 1 billion people affected worldwide per year accordingly. In Europe, for example, in 2010, the total annual cost associated with the treatment of headache amounted to 42.5 billion euro. It has also been concluded that women suffer more often than men. Migraine is associated with the comorbidities that aggravate development of the disease. I would like to highlight depression, panic disorder, anxiety, sleep disorder, epilepsy and stroke. The main difference between common and chronic migraine is measured by the quantity of the attacks. Common migraine is represented through at least 5 attacks, whereas chronic migraine lasts 15 or more days per month for more than 3 months. It's so important, which enlists at 8 days per month and has the features of common migraine. Somewhere between 3 to 7 million people suffer from chronic migraine only in the United States. Early finding in Russia demonstrates similar results. For a long time, chronic migraine has been identified as a complication of common migraine. In 2013, chronic migraine has been separated as a distinct nosological form because it has the peculiarities of pathogenesis and therefore has other principles and approaches to the treatment. And first, we did literature review that has been performed, followed by investigation of treatment characteristics for common migraine that connects with bladder, triple energizer, gallbladder, and pericardium meridian. And What about chronic migraine? Notably, there is only little information in Su and Lin Shu and the connection about the liver meridian disorder. Hence, we decided to conduct this research of chronic migraine. So, we started with a pilot study which contains two groups of patients. First group with the common migraine and the second with the chronic migraine. And we used the pulse diagnosis. This slide shows the organ and bowels according to three position, Chuang Guan Cho. And next, we found that in the regards to common migraine, gallbladder and triple energizer meridian played a crucial role, whereas for chronic migraine, the key player are gallbladder, triple energizer, and pericardium and liver meridians. Subsequently, it may be concluded that chronic migraine is a complication of common migraine. Nevertheless, the modern conception of Western medicine considers chronic migraine as one of the paroxysmal conditions, similar in pathogenesis to depression, panic disorder, anxiety, sleep disorder, stroke and epilepsy, as I said before, are completely correlated to the concepts of traditional Chinese medicine that have been associated to the liver meridian disorder and internal wind. And we can see the connection between Western and Oriental medicine about chronic migraine. So, I would like to present our randomized trial. The aim was to evaluate the effect of different acupuncture techniques. So, there are acupuncture, electroacupuncture, hand acupuncture on main clinical indices of patients with chronic migraine, the number of analgesic use, and the dynamics of chronic migraine comorbid disorder. So, the study involved 84 patients, inclusive of 60 women and 24 men, aged from 18 to 63 years, with a diagnosis of chronic migraine. Patients were randomized in 4 groups, and the Topiramate was administered in all groups in dose of 100 mg daily. Topiramate is a first-line anti-epileptic drug that shows another connection with Western and Oriental medicine. And the patients were evaluated before treatment, after 4 weeks and 16 weeks from randomization. According to our pilot study, pulse diagnosis and reflexology theory, we used acupuncture points of the liver, stomach, and gallbladder on the group of hand acupuncture. So, in the group of acupuncture, we used these points. This recipe included the total of 8 sessions for patients with a diagnosis of chronic migraine. Acupuncture points change from each of the 8 sessions. Notably, session lasts 20-30 minutes, 3 times per week, with neutral method. We did. For the group of electroacupuncture, we excluded the points, the neck and the face, and we used only peripheral points instead. According to our result that I will gladly present you, a creation of the patient pattern for invention for the treatment patients suffering from chronic migraine. I would like to present our result of comparative analysis of headache frequency. We can see statistically significant difference comparing the results in all groups of acupuncture before treatment and after treatment. And so, and we can see a significant difference comparing with all groups of acupuncture with control groups. And what about number of analgesic use? It's so important indices because patients suffering from migraine mostly have medication overuse headache that aggravates the disease and results in significant reduction of quality of life. And what do we see? Statistically significant difference comparing the result before and after treatment in all the groups of acupuncture compared to control groups. Another so important indices is dynamics of autonomic dysfunction. We analyzed the questionnaire of one of our Russian famous scientists, Professor Vane. It's so popular in Russia, we use, and it includes 11 questions in order to assess the autonomic dysfunction, such as loss of consciousness, numbness or coldness of foot or hands, sleep disorder, and lesser patient get scores, better conditions are. So, thereby statistically significant difference comparing the result in all the groups of acupuncture with a control group are clear. We have to recognize the group of hand acupuncture that shows significant reduce in autonomic dysfunction comparing with acupuncture group and control group. For anxiety disorder dynamics, we use the hospital anxiety and depression scale, and we can see statistically significant difference comparing the results in the group of acupuncture with the group of electroacupuncture, and differences between acupuncture group with the control group. So, I would like to say that each of acupuncture methods had an impact on various clinical aspects of chronic migraine and comorbid disorder. So, hand acupuncture appeared to be the most effective in treatment of autonomic disorder. Nonetheless, the use of acupuncture result in the significant reduction of headache intensity and regression of anxiety disorder. And electroacupuncture group showed a significant increase in pain threshold and the least number of days of headache per month. In conclusion, I can say that acupuncture is a method of choice in the complex treatment of patients with chronic migraine, taking into account complex diagnosis, the individually oriented approach in prescribing of different acupuncture for successful treatment and subsequent rehabilitation of patients with chronic migraine is required. In my opinion, only by combining both Western and Oriental medicine, we can create a medicine of future. Doctors of Western and traditional medicine have to work together for the improvement of all, and for everyone we love. Thank you for your attention. Now I will be happy to answer any question you may have.
Thank you very much.